Hey guys, my name's Chris, 25 years old. I'm currently in the hospital right now. One day after an L4 L5 spinal fusion for spondylolisthesis. And I'm looking a little rough. I definitely feel a little rough. Um, Good news, woke up, my legs felt great, hands felt great, no numbness, so that was pretty good. As expected, there's just a lot of pain in the operated area, so it was weird dealing with that. They had me walking around a little bit today, and it's definitely like learning to ride a bike again. It's not as easy as you would think it would be, but I wanted to document my journey here and let some of you guys that are in the same boat I was, see how I come through this. My goal is to be better than ever once I'm healed up. So, the procedure I had was a PLIF. The doctor went through my back. He was going to try to salvage the disc, but when he went in there, I had pars fractures and it was very unstable. And the doctor made the best decision to clean it all out, take out all the broken bone, and he cleaned the disc out and used a cage and I believe synthetic bone to give me a solid fusion. He was able to straighten me out pretty good and align my vertebrae back up. So I haven't seen an X-ray yet, but I'm definitely curious to see, how my before and after picture looks. But like I said, I mean, day one, definitely expect a little bit of pain, to be uncomfortable. Um, I'm sure for the rest of this week I'll be pretty uncomfortable, but that's to be expected. It's a very traumatic surgery, especially getting the bone fusion. And I have pedicle screws and all that too. So, but I want to keep these videos coming in the next days and weeks, months, and try to be a little bit of an inspiration. I know this is a difficult surgery. There's a lot of negative stuff. Everybody's very negative, and I really think every case is unique, and it really depends on the individual, depends on the doctor, depends on so many different factors. But I think if you're younger and healthier, kind of like me, there's definitely life after back surgery. So um, stay tuned, and I'll give you some honest updates. Hey guys, Chris here. Day two after my spinal fusion surgery, and just want to fill you in on what to expect. You're definitely going to be sore. I mean, there's a lot of pain. Um, you're going to get kind of uncomfortable being in the bed. You're uncomfortable going to the bathroom. Um, so the hospital atmosphere wears on you, but you're in a lot of pain. My best advice would be to listen to the nurses, listen to the doctor, and take the medication as much as you can um, at first. Just because, trust me, you're going to be in a world of pain. I'm not trying to scare you off. It's manageable, but you got to relax. You got to take the meds, and for the first couple days, don't expect too much. I did walk yesterday. Once I was up, I can do it. It was just getting up was the hard part. Um, they took all my tubes are out. I don't have any IV. I don't have any drainage tube anymore. So everything's out today. And I'm going to do a little physical therapy later today. Maybe try walking upstairs. Um, and then they're going to try to let me go home tomorrow. Alrighty. Day 3 in the hospital after L4, L5 spinal fusion for spondylolisthesis. And feeling better today. Every day you definitely get progressively better. The whole hospital scene's kind of wearing on me. And the good news is that the doctor said I could probably go home later today. So that'd be a total of 3 days after surgery in the hospital. Um, in all honesty, I couldn't have left if I wanted to. You're going to be in a lot of pain. You're going to be in a lot of discomfort. Um, and again, that's not meant to scare you off, but I'm going to try to make a video down the road maybe to better prepare you for what to expect in the hospital. Um, but I can tell my back's been getting better and better. I've been feeling it. It seems stronger back there. My walking's getting more confident. So everything's coming back, and it's only been 3 days. So, and it's a very traumatic surgery to have. So they're releasing me on basically restrictions on everything except for walking. Walking is the best thing you can do to encourage the bone growth and encourage the fusion to really take place. So I'm gonna get home and just take it easy and get a lot of sleep, relax. I'm gonna try to have a healthy diet. I'm also gonna make it a habit to walk and keep you posted on how I feel down the road, and 1 week, 1 month, a couple months, and the name of the game is I want to start working on diet, exercise, and hopefully feel like my back was never damaged in the first place. So looks like I'm going to be leaving the hospital later, and we'll go from there.